So the last step in our treatment plan of today is treating the glabella lines and the crossfeet lines, as we have discussed before. And I have mentioned before that she is a perfect candidate because at rest she does not have a significant glabella line, but if I ask her to frown again, you can clearly see that she has strong muscle activity, especially in the procerus area, with formation of a quite symmetric glabella line. I start injecting the procerus muscle with Allergan's botulinum toxin by forming a little pinch of the skin, like here, injecting deeply into the muscle with the bevel of the needle up, and slowly but steadily injecting 4 units of Allergan's botulinum toxin in that area. Did that hurt? The last point on that side is the lateral part of the corrugator, which, as we know, inserts a little bit more superficial. So the most lateral injection point in the glabella is the most superficial injection point. I again shift the tissue a little bit, make a little pinch, and directly inject, but more superficially than the medial point, 4 cc of Allergan's botulinum toxin. So the origin of the corrugator and the bony insertion is in the medial part of the corrugator. That makes that injection point best to be injected deeply. So I block with my finger a little bit off here. I shift the tissue in order to make it almost pain-free, and I inject the medial part of the corrugator deeply with 4 units of Allergan's botulinum toxin. The lateral part and its fibers are inserting more superficially, so we inject not as deeply as the medial part. And I slowly inject in that point 4 cc, 4 units of Allergan's botulinum toxin here. So Nicky mentioned before that she's concerned about seeing the onset of fine lines around her eyes, especially when she's smiling. And if we ask her to smile, we can see that she belongs to that part of the patients that form crossfeet lines almost exclusively below a virtual line that we can draw from the lateral canthus horizontally. So she would be injected with the injection pattern of Allergan's botulinum toxin staying below that horizontal canthal line. We know that there is another part of patients that upon maximum smile form lines also above that line, and they can be in label injected as well. She does not require to be injected in that area. So if I ask you to smile again, please, you can see this little radial circle of lines, and we would inject 3 injection points, staying roughly 1.5 to 2 centimeters away from the lateral canthus of the injected eye. So we are injecting 4 units of Allergan's botulinum toxin per injection point, and in that area it is important to be aware of the injection direction. So we should always be sure that we let the needle point outward from the lateral eye angle facing the temple area. So I start with the upper point, injecting. That is a very superficial muscle, so I don't need to go deep with the needle. I go a little bit oblique and I inject slowly 4 units of Allergans botulinum toxin. That can, in that area where the thin skin, create a little visible blab which normally blends in after a minute and not leaving any visible contours on the skin surface. Second point. Painful?
Mm-hmm.
She doesn't feel anything. Slowly. 4 units. The last point. We have to be aware of that area. We have almost a lace of fine vessels in that area. The ones that are already shining through the skin should clearly be avoided when injecting. Sometimes hitting a little vessel is not avoidable and one should press a little cotton wool pad on it immediately.